My name is Dr Vamsee Priya. I am a nephrologist at Apollo Hospital, Hyderguda. Today I am going to discuss with you about dialysis access care and post-dialysis precautions. When the patient needs a dialysis, the patient has about three options available. One is AV fistula or arteriovenous fistula, AV graft or arteriovenous graft, and a catheter that is used for hemodialysis. Fistula or AV fistula is a connection made between an artery and a vein. It is performed by a surgeon and it requires a small incision. It is not a major surgery, but it does require some time for the AV fistula after the surgery for maturation. Usually about 8 to 12 weeks is required for the maturation of the access. The fistula is completely natural and it is under the skin, so it has less chances of infection as compared to the other access. When you have an AV fistula that is used for dialysis, the dialysis technician or the nurse cannulates the access. They put two needles in the access. Through one needle, it is connected to a port and the blood is drawn and given through the machine, and through the other needle, another port is connected and the blood is returned to that one after cleaning procedure. This is how the procedure is performed. Dialysis is generally a painless procedure, but to keep the access from infections, you need to take certain precautions. You always have to keep your hands clean at all times. I advise you to wash your hands frequently and thoroughly with soap and water, especially when you are finished with your household activities, or even when you go out and you touch surfaces, tables, or in public transportation and all, you have a lot of microorganisms, bacteria and viruses. So make sure your hands are always clean by washing it from time to time. The other important thing is to not to touch the access. Usually the access or the AV fistula that is placed either at the wrist or on the forearm. So you need to make it a habit to not touch the fistula arm or touch that side, so that you protect it from or keep it away from infections. The other precaution that you need to do is to not sleep on that arm. For some patients it's a habit. They sleep with their arm under their neck or head, and during that time the fistula can get obstructed or the blood flow can be a problem during that time. So you always need to make sure that you get out of that habit. If you have a habit on sleeping on that arm, it's a definitely no. And another thing you need to make sure is you do not wear any tight fitting garments that is compressing the fistula directly. In case of a wrist, the fistula that is placed on the wrist, in case of women, bangles or wrist watches or any kind of constrictive bandages that are used, you need to make sure it's better to not wear, but if you have to wear, keep it very loose and not constrict or put weight on that one. And the blouse also, when you're wearing a blouse, make sure that the blouse is on that arm, it's loose. And even for the shirts, whether you're wearing a t-shirt, make sure that you wear a loose fitting garments. The other important thing that you need to remember, or I advise you, is to not lift heavy weights with that arm. Let's say if the fistula is in the left arm, usually we use non-dominant arm, that is the left arm in case of right-handed people, or right arm in case of left-handed persons. So we advise you to not lift a lot of weight, that is keep it about like 3 kilograms, 3 or 4 kilos, not over that. With the fistula we need the blood flow, and we need to, for it to perform adequately, we need to make sure we are not constricting it or putting any pressure on it or any weight there, so we do not develop any obstruction upstream for the access. And also keep it clean at all times. The other option that is there is temporary. Let's say for example, if a patient requires a dialysis right away or within the next few weeks, we can only put a catheter which usually goes in the neck, or sometimes we also put catheters that go in the chest area, either the right or the left side. These 4 areas. These catheters are only temporary access for dialysis. As I said before, the AV fistula takes about 8 to 12 weeks for it to mature and for us to be able to use it. So when we place the catheter, you need to take some precautions for the dialysis catheter. So when the dialysis procedure is done, the dialysis staff properly cleans that area. Make sure they sterilize it. If you need to have, they also put an antibiotic cream and keep it very sterile and put a nice dressing around that area. What you have